Hello and welcome to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we'll be talking today with three guests. We're focused on parent and family resources that St. Tammany Health System has available to our service district. We'll talk first with Dr. Perry Russell, who's a nurse practitioner with St. Tammany Pediatrics, our primary pediatrics clinic. Then we'll talk with Dia Frederick, who is a pediatric speech pathologist and part of the team of pediatric therapists in our Wellness and Therapy program. And last, we'll talk with Lori Cage, who directs the Parenting Center, which is a great resource for parents, grandparents, and others who take care of children in our community. So first, we're with Perry Russell. Dr. Perry Russell, nurse practitioner, welcome. We're so glad you're here.
Thank you for having me.
So first, before we talk about St. Tammany Pediatrics, I want to talk about Dr. Perry Russell, nurse practitioner,
Okay.
because I think lots of people don't know what that means.
So DNP is a doctorate of nursing practice, and actually that degree was conferred to me last May during the pandemic. So
An adventure.
Yes, it was. So I was one of the many graduates who didn't get to walk across the stage, but still get to practice in that capacity. So it's been a wonderful thing to be able to bring to our practice and have that advanced training as a nurse practitioner and bring that to the pediatric clinic.
Fantastic. Well, talking about the pediatric clinic, your role as nurse practitioner, your partners are pediatricians. So talk a little bit about the team and how you all work together for kids and families.
Yes, so we are in the primary care pediatric clinic. It's the outpatient clinic on Highway 21 in Covington. And there are 5 providers there. I work with 4 wonderful physicians and then myself. The physicians serve in the capacity of the primary care physician. So patients are actually assigned to the physicians. And what I do is mainly support them and support our patients and families beyond that. So we do wellness visits and health vaccination visits. We also see patients and families for sick visits there. And you know, the wonderful thing that I think we have going with us in having a nurse practitioner in our clinic is that we're able to really accommodate patients just about any time. So those same-day appointments are so important for children if they are ill. So that's a nice thing that we can bring to the community and to our practice. And then we have, of course, a fantastic staff. So from the front desk, ladies that greet and welcome and check in our patients and families, to our nursing staff, which has been with the practice, most of them for many, many years, and just work very, very well together and very well with us providers. And are so passionate about making sure that the patients and the children that we see are comfortable and well taken care of. All the way to the providers who really care about making sure that the families and the parents understand and are part of the plan of care when they come in. So I think just as our team in general just really works well together.
Beautiful. It sounds like a great team and a great place to work in St. Tammany Pediatrics. I'm trying to think as a parent, if I'm already established with St. Tammany Pediatrics and one of the pediatricians is my children's pediatrician, I'm bringing them in once a year for their healthy well check and everything's good, check that off, and sports physicals. But okay, I pick up one of my kids from school in the afternoon, they're running a little fever, it's 3:30 in the afternoon. So potentially I could call and get to see you because you might have a same-day opportunity that maybe my established pediatrician would be booked up.
Absolutely. And to be honest with you, we do have same-day appointments that are held for that reason
for the purpose.
with each of the primary physicians. But positively, that is something that, parents, when that happens, the child gets off of the bus and is running fever, or you get that call, especially within the past year with this pandemic, you get that call from school that says, hey, your child has a cough and we need you to come and pick him or her up. But to be able to just call us directly, actually, those calls come directly to us, which is very important to parents, to our clinic, and be able to say, listen, I've got this sick child that really needs to be seen. How quickly can I get in? And typically we can accommodate parents very, very quickly, absolutely same day.
Wonderful. Well, and you mentioned the pandemic. Obviously, for the past 15 months, that has been our focus. It's been a world focus. It's been everyone's focus. And we're excited to be coming out of that and to begin to see infection levels getting lower.
Indeed.
Our hospital consistently has a COVID patient census that's in the single digits. But tell me a little bit from the children's perspective. We can now offer vaccines to 12-year-olds, so catch me up.
We can. So the Express Care, it's adjacent to our pediatric clinic. There on Highway 21 is offering vaccinations, and again, the recent approval is for 12 and up. We don't do the vaccines there in our clinic, but what we do offer is still a very wide variety of screening tools and testing tools in our clinic. So point of care tests such as a rapid COVID test or a PCR test, which is a little bit more lengthy, more specific test that can be done to identify the COVID virus in a patient. And then, of course, we have other point of care tests such as strep and RSV and flu, which we are actually starting to see a little bit more of emerge, those other things that normally we might have seen perhaps 6 months ago, that now that everybody's sort of mixing and mingling, we're seeing those normal pediatric type illnesses like RSV return and strep. So we do have the capacity to offer those immediate same-day testing, testing opportunities right there in our clinic.
Fantastic. So that makes me think too about the age range for your practice, all the way from newborns to teenagers headed off to college.
Yes, definitely. So from 0 to 18 years old. And, I've got to tell you, it's kind of tough sometimes to see those 17 and 18-year-olds and be bidding them farewell to go off to college. So, over the years that I've been with the pediatric practice, I've become attached to the patients that I've seen and watched them grow through the years and come to know their parents there in the clinic, but also in our community. So sometimes it's a tough thing to say goodbye, but it's always nice to welcome a new one.
And to see them from 0 to 18, it's beautiful. One of the things that you talked about, you vaccinate and test for all of those childhood diseases, and then right next door in Express Care is where they're doing COVID vaccines for the 12 to 18-year-old set as well as adults. And that brings to mind the last thing I wanted to talk with you about, and that is the location where you are.
Yes.
You have some neighbors in the building that are part of family care.
We do. We have such a great collaboration in our building right there on Highway 21, and not only right there in the facility where we have outpatient pediatric therapy, the parenting center soon to be there with us, the Express Care folks right next door, and then of course the pediatric primary care. But not only right there in the building do we have that wonderful synergy, but we are now close to main campus hospital. We're right across the street from Dr. McDaniel's office, pediatric ortho. We are not far at all, right around the corner from the outpatient pavilion. And we're very easily we have ease of access from I-12 too. So it's really nice to have those resources really close by, but also to have that synergy within the outpatient pediatric realm right there in our building.
Well, that is wonderful. Dr. Russell, thank you so much for joining us today. I appreciate you coming.
Thank you for asking me and having me.
Great. We've been talking with Dr. Perry Russell, nurse practitioner from the St. Tammany Pediatrics practice of St. Tammany Health System. We'll be up next with Dia Frederick, a pediatric speech pathologist, who will talk with us about pediatric therapy.